it was a blessing for me because it kept me alive. Because the osteomyelitis was in my bone marrow, and I was a MRSA carrier back then. So all this, the MRSA was in my blood. So because of them, they kept me alive technically. So I was ecstatic that I had someone that I can go to and didn't have to go and sit and wait in the medical center and go through all that harassment and waiting that you have to go through sitting in the emergency room and being told to be seen. I know if I come put my name on the listing, those individuals are going to see me. They're going to be happy to see me. And they also gave you breakfast, which made it even better. So it worked out great for me. Probably the thing that stood out most to me happened recently. Maybe it had to be about 4 years ago, 3 years ago. My children's mother had cancer. And they were getting ready to do surgery at St. Luke's Hospital. And the surgeon came in, and his assistant came in, and it's this young lady. And I'm looking at this young lady, and I'm going, I know you. She said, no, I don't think so. I said, ma'am, I know you. I'm good with faces. I know you. And I asked her, where did you go to school? And she said she went to school here at UT. And I'm going, you was part of the homes program. She go, how you know that? I said, because I work for Healthcare for the Homeless Houston, who oversee the homes program. She go, yes, that's when I was in school. That's where I worked for a number of years with the homes program. So, like I told my children's mom, my ex-wife, I go, you're in good hands. Everything's going to be okay. And this surgery went well. So, I felt really good about that. It was just being able to know someone that was part of the surgical team that was going to help her. And it worked. That was a good thing. And what happened was the research program that they put together was to see if you take and connect a community health worker with an individual that was a frequent flyer of the emergency room, would it work? And it turned out that once we was able to get people their SSI and help them get Medicare, Medicaid, or their gold card, we was able to get them a personal care home, a personal care physician, and it worked. And now you have the city of Houston have the same programs that they've done followed us in different cities because they do work. It stop people from going to the ER. But one of the things I normally talk with providers, that no matter what your skill is, I think you should take motivational interviewing skills and learn how to, instead of asking closed questions, you ask open-ended questions. And you have to remember that in order to provide care for an individual, that individual needs to be part of the solution because us as providers, we do not have the answer. And it works much better when you have the individual involved. Learn about homelessness. Learn about the different faces of homelessness. Because I know lawyers that's home. They have a guy, and I'm not going to say his last name, but his first name is Jack. Was a great lawyer. Went through mental health episode, wound up on the streets. And he was on the streets until one of his ex-colleagues saw him, cleaned him up, and got him back to work. And he became an advocate for a number of years for homelessness. You have to listen to people's stories, and you have to know that the impact of words. See, most people, when they see a homeless individual, they try not to make eye contact. They don't even ask you how you doing. That's why the homeless community is called the invisible community. I told Dave that when I was on the streets, when I was finished saying my prayers, was that if someone come help me, I stand on that soapbox. And my mom done passed away now. But one of the things she was always say, you have to be careful for what you ask for because you might get it. And if you get it, it's your duty to do what you said she was going to do. And that's been my journey now, is to do as much as I can in order to help the homeless community and try to always reach back and grab someone to bring them up.